Ace your NCLEX, Management of Care Essentials. Hey future nurses! Welcome back to the channel. In today's video, I will cover a super important NCLEX topic, Management of Care, a major part of the safe and effective care environment category. Management of care makes up a big chunk of the NCLEX, around 17 to 23% of the entire exam. It focuses on how nurses coordinate, prioritize, and delegate care to keep patients safe and make sure everything runs smoothly. What's included in management of care? Let's break down the key topics you need to know. 1. Advanced directives / legal rights. 2. Informed consent. 3. Client advocacy. 4. Delegation and supervision. 5. Prioritization and time management. 6. Case management, client rights and advocacy. 7. Confidentiality, yes, HIPAA again. 8. Referral and continuity of care. 9. Assignment of client care. 10. Ethical and legal practice. 11. Interdisciplinary collaboration. 12. Resource management. 13. Performance improvement, quality assurance. 14. Utilization review. 15. Concept of leadership and management. In this video, I'll explain each of these in simple terms, give you tips to remember them, and show you how they show up on the NCLEX. So, grab your notes and let's get into it. Advanced directives and informed consent. Let's start with advanced directives and informed consent, two things that protect a patient's right to choose what happens to their body. An advance directive is a legal document where a client states their wishes for healthcare in case they can't speak for themselves. This can include a living will, which tells providers what treatments the client wants or doesn't want. A durable power of attorney for healthcare, where the client chooses someone to make decisions for them if they're unable to. Informed consent means the client agrees to a procedure after fully understanding the procedure itself, the risks and benefits, alternatives, and what could happen if they refuse. Exam tip: the provider explains the procedure. The nurse witnesses the signature and makes sure the client is competent and understands it. If not, call the provider back. Example NCLEX question: a client is about to sign a surgical consent form but says, "I still have questions about the procedure." What's the nurse's best action? A. Provide more information about the surgery. B. Reassure the client it's a routine procedure. C. Call the provider to come back. D. Ask the client to sign now and ask later. Answer: C. Only the provider can explain the procedure in detail. Client advocacy, one of the most important roles a nurse plays. Being a client advocate means standing up for your patient's rights, safety, and preferences, especially when they can't do it themselves. You're the patient's voice. Even if it means questioning a provider's order or getting social work involved, if it's in the patient's best interest, you do it. Here are some examples of advocacy in action. A patient doesn't fully understand a procedure, you speak up and ask the provider to re-explain it. A patient refuses treatment, you respect their decision and support them, even if others disagree. A provider writes an order that seems unsafe, you clarify it before carrying it out. You suspect abuse or neglect, you report it to the proper authorities. Exam tip: the client is always your priority. Advocacy often shows up in ethical and safety-related questions, especially around informed consent, refusal of care, or vulnerable clients. Example NCLEX question: a nurse is caring for a terminally ill client who refuses further chemotherapy. The family insists the client continue treatment. What is the nurse's best response? A. Follow the family's wishes since they're next of kin. B. Encourage the client to continue for the family's sake. C. Notify the healthcare provider of the client's decision. D. Educate the family about the benefits of chemotherapy. Answer: C. The nurse advocates for the client's wishes and informs the provider. The client has autonomy. Delegation and supervision. Next up, delegation and supervision, something nurses do all the time in real life and on the NCLEX. Delegation means assigning a task to someone else, but the nurse is still responsible for making sure it's done right. You'll often need to decide, can I delegate this to an LPN or an RE? Here's an easy way to remember it. RNs do assessments, teaching, intravenous meds, unstable patients, basically, the complex stuff. LPNs can give oral meds, perform wound care, monitor stable patients, no assessments, teaching, or forward pushes. REs, nursing assistants, can take vitals, assist with hygiene, feed patients, ambulate and transport. If the client is unstable, newly admitted, or needs teaching, it's the RN's job. Example question: which of the following tasks can the RN delegate to a RE? A. Monitor a new post-op patient. B. Teach a diabetic patient how to inject insulin. C. Take routine vital signs on a stable client. D. Administer oral medications to a patient. Answer: C. REs can take vitals on stable patients. Teaching and meds. That's RN or LPN territory. If you found this helpful, don't forget to like, share, and subscribe to the channel for more NCLEX study material and nursing tips.